patients these days want to know as much as they can about surgical options or even medical options before they jump right in and have those things done or take a pill. And so I found that the information I get from Bladder Health Network really helps me in counseling patients. They really like that subjective data they get from the comprehensive testing, and then the physician-backed interpretation really helps me counsel them, and also makes me feel more comfortable in doing a sling procedure or deciding to use a urinary antispasmodic versus surgery if I've got that subjective data right there in front of me. Also, the staff that are provided to help us do the testing is really so simple for our practice here. Our office administrator doesn't have to worry about calling someone in to do the testing. The Bladder Health Network staff are here on time. They do the work professionally. The patients like them. They've integrated very well within our own staff here, even though they're really an outside non-employee. We've enjoyed working with our particular person, Olga here, who does a great job. The patients really understand what's going on when she does the testing for them, and I've had no negative feedback at all, only positive from the patients. We had a qualified nurse who did our testing before we used Bladder Health Network. She was never really formally trained, and the information we got basically was valuable to us, but not as specific or as detailed as what we get from the Bladder Health Network comprehensive testing. The information was really more up to the individual physician's knowledge to make an interpretation, and even though that helped me a lot with patients and decisions for therapy and surgical treatment, I really never felt quite the cutting edge in that kind of thing. The other issue was I was beginning to go to a lot of courses about bladder health and surgical treatment such as slings and other things that were really stressing that you needed to have a more comprehensive urodynamic study than what you may get just from a Q-tip test or just some simple measurements that you might just do at the bedside. The interpretation that I receive on the formal reports that I get from Bladder Health Network are very valuable. They actually come to our office in a printed form. There are options, I understand, to get them straight off the internet if you like. But I found it very valuable that in addition to the physician's official formal interpretation, I've been able to easily call them and get a little bit more information perhaps, or if I wasn't exactly clear, and that one-on-one verbal talk with them, which is part of our service here, is very valuable to me. A lot of times on those patients it may not fit exactly the norm.